All right. Well, welcome everybody to the final session of the annual conference. Hope brings us together. We're so grateful for everybody that has joined us, whether you joined us for a little bit or the whole day, or you're watching it later on. Thank you so much for caring and for showing up. And to wrap up our conference, I'd like to introduce Bernie Seifert, our Deputy Director here at NAMI New Hampshire.
Okay, thank you, Kimberly. Good afternoon, everyone. My name is Bernie Seifert, and I'm Deputy Director at NAMI New Hampshire. And so thank you so much for staying with us just a few more minutes. We just have a few more minutes left. And I want to say thank you for being part of this very thought-provoking, inspirational, and a love-filled day. Such wonderful presentations all day. We appreciate your being here, and special thanks goes out to those of you who are able to add donations when you registered for this conference. Those funds will go a long way, I assure you. The recordings of today's presentations, I think Kimberly has said this a few times today, will be available on Whova for another 30 days. And afterwards will be on our NAMI New Hampshire YouTube channel and on the NAMI New Hampshire website's annual conference page. I want to give a special thanks to our sponsors, our education sponsor, Janssen, and we have 5 supporter sponsors. We have AmeriHealth Caratus, New Hampshire, Carillon Behavioral Health, HCA Healthcare, that includes 3 hospitals, Frisbee Memorial Hospital, Parkland Medical Center, and Portsmouth Regional Hospital. Thank you to Moms Rising. And fifth but not least is the New Hampshire Community Behavioral Health Association. Thank you very much. Now I want to introduce Ward Bennett. Ward is the Healthcare Policy and Advocacy Director for Janssen, our education supporter for today. Ward has been a supporter of New Hampshire, of NAMI New Hampshire, both personally and professionally for years. I've known Ward now for a few years. He's served on the NAMI New Hampshire Board of Directors, and he actively participates in our monthly Public Policy Committee. He's gone through the NAMI New Hampshire in our own voice speaker training, as well as the NAMI peer-to-peer program. So he's here today to make a few comments. Ward?
Thank you, Bernie. Really appreciate it. And it's a very nice introduction. As Bernie said, I have been partnering with NAMI New Hampshire for over a decade now, and it's been a fantastic group to be part of. And as you all heard, I am a healthcare policy and advocacy director for Johnson & Johnson and the Janssen companies, and kind of a unique position in the pharmaceutical industry. I haven't met anybody who has my exact roles, because if there's a policy, a legislative or a patient access issue in one of the disciplines that I cover, then I engage with my advocacy partners to ensure patients have access to the healthcare system, and we support that. I cross over many disciplines as well, so I get a kind of a full picture of the healthcare system, such as oncology, rheumatology, mental health, and many others. And I've been in this role for 20 years. But probably a bit over half of that has been in mental health, and I can assure you that coming from kind of the medical side of medicine, there are kind of 2 distinct medical systems in the U.S. And that's even greatly since post-COVID, there's been so much change in the offices and the hospitals that I'm in every day. It's a challenge just to kind of find healthcare systems, and the mental health system and the physical health system, for lack of a better term, they're very, very different. Physical health is discussed, it's supported, it's focused on, and mental health isn't probably talked about so much. And that's why conferences such as this are so fantastic, and things that Ken Duckworth's doing with the books to kind of get the conversation started. It's just so key. NAMI New Hampshire is a very special group. I've covered the 6 New England states for most of my career, and I can tell you there's very few, patient advocacy groups and like-minded folks who put the passion and energy and the amount of people that NAMI New Hampshire has. It's just fantastic. So that's why there's such a a pleasure to partner with, and I am honored to partner with them. And one of the most unique things that really has been a learning for me and kind of my journey, both physically and mentally, is the people that they bring in to present at their meetings. You know, the speakers have always been so open and, you know, sharing their stories and getting other people to possibly share theirs. Because, you know, a lot of times, you know, folks won't mention depression and anxiety, trauma, and those sorts of things. And every meeting that I've been to has been really fantastic, and it's helped me kind of, you know, move along. You know, because, you know, my story is I'm 60 years old, so I'm getting up there. And I've had rheumatoid arthritis my whole life, but I only got diagnosed about 5 years ago. And it wasn't for lack of trying, but it was, you know, kind of a long road. And I went to a lot of doctors as a kid, and, you know, never heard the word arthritis. So, you know, now we're working on it, and not that I wasn't working on it, but now, you know, that it's focused and in there, it really, you know, it's been helpful. And then, you know, when I started going to these NAMI New Hampshire meetings, I was listening to everything going on around me, saying, you know what, this sounds like stuff that I need to work on. And it just, even then, took me a long time, you know, to really work through that. So I just say, as a person who has been in the thick of this, both from an advocacy and, you know, knowing the clinical and medical and access issues that I have, you know, there was some big gaps for me in getting to where I needed to go. You know, and, you know, working through things like, you know, ADHD, anxiety, and those sorts of things. And it's great to have, you know, a home, you know, NAMI New Hampshire and like-minded people to do that. So, you know, it's kind of like the old story of the cobbler's children having no shoes. Like, you know, you're in there and you're like, all right, you know, we can do this, but, you know, you got to help out the other folks. So, you know, essentially I was advocating for, you know, thousands of people like me, yet, you know, I was having trouble helping myself. So, you know, I tell all of you this because, you know, we've heard some great speakers today tell their stories, and each one of those people, you know, needed a hand up or a kind soul to hear their story. I believe that the Ken Duckworth NAMI book, our book, as he says, is going to open many minds. You know, real people, real, you know, chapters with folks that, you know, are telling their story, and that really helps the conversation get going. I think that's really the key there. You know, and I think just, you know, kind of in closing, you know, to paraphrase Margaret Mead, I think, you know, in my mind, you know, advocacy, empathy, and community is really the only avenue for change that, you know, exists. And I think that's especially true in mental health. So I really am very thankful that everyone joined the conference today, and it was such a great conference put on by NAMI New Hampshire. And I really am kind of humbled and honored that this is, I think, the third year in a row that I've had a chance to speak to everyone at the annual conference. So thank you very much. I appreciate it. And I'll throw it back to you, Bernie.
Thank you very much, Gord. I so appreciate your sharing your story. And thank you for being here today and for being a sponsor. Really appreciate it. So I know that we've been asked a few times where to get a copy of of Dr. Duckworth's and I guess our book, You Are Not Alone. And just a reminder that Gibson Bookstore in Concord is providing the book at 20% discount using the code, and I think the code has been shared a few times today throughout the day, and I think Kimberly was going to put it back in the chat for everybody to see. And also to remind you that Target is offering the book also at a significant discount, so that's available for you there. And before I hand this over to Kimberly, I want to announce, remind people to please fill out the survey that you will be getting by email. We seriously take a look at all the feedback, and it helps us as we plan for future educational programs. And once you've filled out the survey, you'll have the option of downloading a certificate of attendance. So if you need a certificate of attendance, you need to fill out the survey. And it's pretty simple and easy to fill out. And before I hand this to Kimberly, she will, before we end, I'd like to hand this over to Kimberly, and she's going to announce the names of the 2 leaderboard winners. So Kimberly.
All right. I had to put it back on this slide so we can surprise everybody. All right, you seeing my slide?
Yes.
All right. So we had some great engagement today. We're just thrilled. It's been so much fun to connect with everybody. There's been so many things going on in Whova. It's been hard to keep up. We do have two individuals who scored a ton of points with their engagement. So we have Jenny Wyatt and Diana O'Connor. Thank you both, and thank you everybody who chimed in over in Whova. We have another giveaway that we are keeping open till the end of the month. So you head back into Whova, you can rewatch some sessions, you can access slides, and find, you know, other ways to connect in there with us. And like Bernie mentioned, once the 30 days is over, we will be able to put all of the recordings on the NAMI New Hampshire YouTube, if not sooner. So that's what we have. The other thing that is on this slide is also what Bernie mentioned already, is the QR code to order the book from Gibson's, and they have generously extended that discount code for, I think, through the end of the week. And that's not alone with what you would put in over there. So with all that said, that's it. Thank you everybody. We're thrilled and just grateful to all the presenters and everyone who gave some of their time today to be with us. So thank you very much.
Thank you.
All right, thank you.
Bye.